Hi everybody! Today we will talk about electrostimulation. I will teach you how to use this technique in our veterinary patients. Electrostimulation can be very useful to treat many different conditions. GLOBUS VET offers you a wide variety of electrostimulators for animals. StimVet 2000 has been developed to treat pets, cats, dogs and horses. Programs and parameters have preset for the most common disease and conditions in our veterinary patients, according to literature and clinical expertise. However, parameters are indicative. It is advisable to monitor every single patient's response during treatment and customize treatments based on individual needs. In any case, a correct patient's anamnesis is fundamental to use StimVet 200 Pro. In veterinary rehabilitation and physiotherapy, electric current is used to reach two main targets: to reduce the perception of pain and to stimulate excitable tissues such as muscle. For such conditions, GLOBUS VET 200 Pro offers you within the same machine two different modes, the TENS and the NEMS. Let's go over these two modes together. TENS is the acronym for transcutaneous electrical nerve stimulation. The analgesic currents are recommended in the symptomatic treatment of peripheral pain. These currents are particularly effective in controlling pain related to the most inflammatory processes such as osteoarthritis. Indications for TENS are post-orthopedic surgery pain, post-spinal surgical pain, pain related to osteoarthritis and discopathy, and pain related to the lumbar region or to conditions such as wobbler syndromes in our dogs. NMES is the acronym for neuromuscular electrostimulation. An electric current can stimulate the muscle contraction, acting on both the motor neuron and the muscle. Stimulation electrotherapy addresses normal innervated and denervated muscles. Neuromuscular stimulation can be used in different pathologic conditions and also non-pathologic situations. Even though electrotherapy does not replace physical activity, it is a very useful tool to be used with muscular atrophy or disease atrophy. Indications for NMES are neurological disease atrophy, orthopedic disease atrophies, muscle reinforcement in a case of cranial cruciate ligament repair when we aim to use a conservative post-surgical treatment, muscle reinforcement, stimulation of denervated muscle, improvement of joint stability, increase of range of motion, and decrease of muscle contracture. Let's go over now patient preparation. As we deal with veterinary patients, let's place them always on a comfortable bedding, on a lateral recumbency based on the treatment we have to perform. StimVet 200 Pro comes with electrodes of two different sizes that will allow you to use them on different patient sizes. As we can see, we have the bigger electrodes and the smaller ones. These electrodes can be also cut to adjust to individual needs. StimVet 200 Pro comes with a water-soluble gel and an elastic band. This gel is fundamental to place the electrodes on the patient, and this band, the elastic band, will help us keep the electrodes in position on our patients.